Hey folks, Dr. Jeff Williams with Chiropractic Forward and Creekstone. I'm back at it once again, hitting the research nail with the common sense hammer, and I hope you're listening. For this article, I want to discuss a news item that I came across just last week. It discussed treating low back pain in the female soldiers with chiropractic care. We've discussed chiropractic treatment for veterans recently, so this blog will just kind of piggyback onto that. The article is called Chiropractic Services Relieve Lower Back Pain in Female Veterans, and it was written by the staff of the American Chiropractic Association. It was published on December 11th of 2017, and it came out on a website called Newswise. Now, it starts out discussing the fact that female veterans are one of the quickest growing groups that are seeking treatment through the Veterans Administration System, or the VA. And it discussed how they've noticed that these female veterans are responding well to chiropractic care for their low back pain. The article is quoted as saying that chiropractic services are one of the conservative, non-drug treatment options for pain offered within the VA system, and that chiropractic care is available at about half of the major VA medical facilities already in the United States. This article from the American Chiropractic Association also mentions some new momentum that is being gained in Congress that may help expand chiropractic services and its availability to our veterans. Representative Julia Brownlee of California and Representative Lucille Roybal Allard, also of California, have picked up the ball and started pushing a broader range of services and healthcare options by supporting the chiropractic care available to all Veterans Act, which is H.R. 103 is the technical designation of the bill on the House side. Now, what an outstanding bill, right? I mean, how can you be against our veterans having a chance at a non-drug conservative treatment to take care or manage their chronic or acute low back pain? I mean, I'm not sure I know a person that is versed on the current research that could disagree with that. Honestly, I don't know how you can. So far, this bill is supported by many of the bigger veterans groups, and rightfully so. The bill would not only recommend it, but it would require chiropractic care to be available at all VA medical centers and designate chiropractic as a standard benefit for veterans within the VA healthcare system. Bravo. Great job. The article goes on to mention a bipartisan companion bill also making its way through the Senate currently. Its designation is S609. Now, at this point, I want to backtrack and discuss the research paper that the whole article from the ACA references. This study that included the female veterans suffering from low back pain, it's the one that the whole article kind of focused on. And the name of this research paper is called Chiropractic Management for U.S. Female Veterans with Low Back Pain, a Retrospective Study of Clinical Outcomes. These long research titles, they're exhausting. Its chief author is Dr. Kelsy Corcoran, and it was published in the Journal of Manipulative and Physiological Therapeutics in October of 2017. So brand new stuff. Now, here's why they did it. The purpose of this research paper was simply to find out if female veterans suffering from low back pain could find relief through the use of chiropractic care and chiropractic case management. And here's how they did it. The authors of this paper did a retrospective chart review of 70 cases of female veterans whose biggest complaint was low back pain. Each of these female veterans received chiropractic case management and care through the VA system at the VA Western New York Healthcare System in Buffalo, New York. Testing was used to compare the baseline and post-treatment outcomes assessed via the Back Bournemouth questionnaire. And here's what they found. The average female veteran was 44.8 years old. On average, they were overweight. 86% of the female veterans were white. The mean number of chiropractic treatments they underwent was 7.9 treatments. Statistical significance was noted for the Back-Bournemouth questionnaire outcomes. The mean raw score improvement was 12.4 points. This represented a 27.3% change for the better from the baseline scores. And it was shown that 47% of the courses of care met or exceeded the threshold for a minimum clinically important difference. Now let's wrap that up and make it make sense. The authors concluded, quote, "For our sample of female veterans with low back pain, clinical outcomes from baseline to discharge improved under chiropractic care." And I'd say that's just another reason to call a chiropractor today. Research and clinical experience shows that in about 80 to 90% of headaches, neck and back pain, in comparison to the traditional medical model, patients get good or excellent results with chiropractic. Chiropractic care is safe, it's more cost effective, it decreases your chances of having surgery, and it reduces your chances of becoming disabled. We do this conservatively and we do it non-surgically. In addition, we can do it with minimal time requirements and minimal hassles on the part of the patient. And if the patient develops a preventative mindset going forward from initial recovery, we can likely keep it that way while raising the general overall level of health. Now, please feel free to leave a comment. Tell me your thoughts. I'd love to hear what you think. And remember, sharing is caring. Share, share, share. We can't make a difference without your help. We all know that by now on the internet. Be sure to find us on social media sites like Facebook, Twitter, Google+, Pinterest, LinkedIn, Snapchat, and Instagram. Also, be sure to subscribe to our YouTube channel. The link is in the description, or hit the subscribe button right below. At the very least, can we talk you into giving us a thumbs up below? A gesture that simple and quick really does help us get in front of more and more people that are looking for this kind of information. Be on the lookout for our new podcast called Chiropractic Forward. It's not there yet, but it's almost ready for public consumption. But in the meantime, you can get more research-related blogs at amarillochiropractor.com/blog. Till next time, thanks for watching. We'll see you.